Do you have diabetes? Or do you have a loved one who has diabetes? Are you aware of how serious it can be to have high blood sugar? Um, Hi, I'm Coach Tony Agudo, and I'm also a extensive health researcher and biohacker. Um, in my half a century of living here and really being interested in health topics, diabetes or high blood sugar is something that will really be hard to ignore. So, for today, I will be presenting a video by Dr. Chad Luxemburg, where he's uh, he's um, he's a medical doctor, he's an eye doctor and surgeon, and he's already been 2 years with Life Vantage. In this talk, he was 2 years with Life Vantage and Protandem, using the products, recommending it to his patients. So, just to give a brief overview of what his talk. He was basically talking about the effect of diabetes and its effect on circulation. So I also did my research, so that it's verified with other sources. So what I saw there, that diabetes actually damages blood vessels. So this aggravates or makes worse the flow of blood, on the blood vessels. It causes atherosclerosis, which is a buildup of fatty deposits on the insides of the blood vessels, thereby again narrowing further the blood vessels, impeding blood flow. So as you know, the whole blood is very much needed in every single part of our body, and impeding the flow or slowing down the flow or preventing the proper flow of blood can have serious effects on our bodies. And diabetes has a very powerful, or rather really detrimental effect when it comes to circulation. So it when your blood vessels are narrow, it increases a lot of potential serious health conditions, such as heart problems, heart attacks, strokes. Those are circulatory problems, right? So those are just but some. It can also cause peripheral arterial disease, where the blood vessels on the feet and the legs are slowly being blocked, and literally the legs will decay, because there's no more blood going there, and it will start with diabetic neuropathy, where the legs are really going to be painful for diabetics, because the blood flow there is very much impeded. So again, it's narrowing of the arteries. So what else does the narrowing or the impeded blood flow affect? It can also be the kidneys. So because there are a lot of small blood vessels inside the kidneys, that they can easily become blocked, or the blood flow will not flow to those areas, and thereby causing serious kidney or chronic kidney disease. And that's where people will have to start dialysis. And do you know that if you have hypertension combined with diabetes, it increases your chances of being in dialysis or having chronic kidney disease between 70 to 80%. So that's a very serious problem. Imagine, I see a lot of all of these nephrology centers where they do dialysis, and they're really, doing good business these days because of the high incidence of diabetes. And chronic kidney disease is more often than not starts with diabetes. That is how serious diabetes can be. Okay, so another thing is diabetic retinopathy, which is you start to lose your eyesight. It first becomes blurry, and then there will be dark spots, or there are different symptoms, but the end result is people actually lose their eyesight because of diabetes, macular degeneration, and they call this diabetic eye disease. So, can you see now how serious it can be if you have diabetes? It's not that you just have metformin, you have stuff that can lower your blood sugar temporarily as a band-aid. That is not a solution. So in this video, Dr. Chad Luxemburg talks about his experience with with his patients on the usage of Protandem, which is an NRF2 activator, which has a profound effect in reducing diabetes in his patients. So let's roll the tape.
And the NRF2 science is the absolute forefront of medical experiments and technology. All the pharmaceutical companies are looking for NRF2 activators. We have like the best one, the cheapest and the safest, and it's incredible. Now, as an ophthalmologist, I recommend the Protandim for various things for my patients. But in reality, lately I've been saying that cellular stress leads to damage to cells, which leads to damage to organs, which leads to damage to systems, which leads to diseases. And really everybody needs it. I don't have to just tell people they need it for their eyes. Sure, you need it for your eyes, but you need it for the blood vessels throughout your body. That's what we just heard about, the endothelial cells. There are blood vessels everywhere. If they're not working well, you have trouble with your kidney, you have trouble with your eyes, you have trouble with your heart, you have trouble with your muscles, you got trouble. So Protandim, necessary for all these things. Now, what have I seen in my practice? Well, we've had a couple of people with diabetes, and we recommend it strongly for diabetes because we know that it tends to lower something called hemoglobin A1C, and that is something that's crucial in the treatment of diabetes. I had a couple of patients that we recommended it to, and within 3 months, their kidney function improved so much that they avoided dialysis. I spoke to their family doctors. They were on the verge of dialysis 3 days a week for the rest of their life. Life-changing event. And both patients, after 3 months of Protandim, had an increase in what we call creatinine clearance. That means their kidney function actually got better. Didn't stay the same, didn't get worse, it got better. Talk about the eye. Really interesting article out of a Spanish university in Madrid. NRF2 activation and oxidative stress in the aging eye. Talking about how oxidative stress, which is free radicals that are not combated properly by antioxidants, cause dry eyes, glaucoma, diabetic retinopathy, and macular degeneration. Well, how would you have something, wouldn't you love to have something that would help people, protect them against those things happening, or help them if they already have them? Talk about diabetic retinopathy, bleeding vessels, poor vessel formation, inflammation, scarring, destruction of the function of your eye. Because inflammation leads to scarring, leads to decreased function, just as we were already talking about the way Dr. Maniscalco said. So Protandim activates the NRF2 pathway, which gives you antioxidants and turns on genes that are anti-inflammatory, and even our patents say that our product is anti-inflammatory, and in one case lists that it lowers C-reactive protein, which is a measure of total body inflammation. So you know that's how it's working. So it's helpful for all of those things. My dad had macular degeneration. He got the wet kind, which is a leaky blood vessel, which leads to scarring and atrophy and lack of function. He needed a shot. Right after that, I joined the company, found out about Protandim. He never needed another injection. Most people need multiple injections in the eye when they get wet macular degeneration. He never had a recurrence. His vision went back from 20/80 to 20/40 and stayed that way the rest of his life for 18 months. And I believe it was the Protandim that did that. When I looked at the back of his eye, I saw less what we call drusen, or pigment accumulation from macular degeneration, than before he started Protandim. And the pigment accumulation is kind of scarring and destruction of the retinal pigment epithelial layer. So if you have less drusen because you're taking Protandim, that's miraculous. As a matter of fact, all of this is miraculous. As I always say, the only thing that's more incredible than the products from LifeVantage is the business opportunity from LifeVantage. So I'd like to end it right there. And that's
So we've now seen the talk by Dr. Chad Luxemburg, and let me ask you a question. Are you interested in taking charge of your health? Are you interested with getting your blood sugar under control? Are you interested with turning back the clock when it comes to aging? We have so much here to offer with LifeVantage. So contact the person who sent this video to you. So whether your objective will be towards better health and taking control of your diabetes, your hypertension, future health problems, for yourself and for your family, I strongly recommend to not delay, because there's a saying that, you know, uh, there's gonna be the straw that breaks the horse's back, and you don't want to get to that point where you're gonna say, I wish I took better precaution. So I strongly advise everybody to take this diabetes problem seriously, and contact the person who sent you this video. Now, if you're interested also in the potential business, we're looking for partners and distributors right now, and we'd want to make a difference in this world to impact diabetes sufferers all around the world. So, Life Vantage is an U.S. and international company. We're present in over 20 plus countries, and this is really science based uh, 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 health, cellular health care that even the doctors use by themselves and recommend. So I strongly recommend to get in touch with us right now. So without further ado, this is your friendly neighborhood common sense coach, Coach Tony Agudo, wishing you a good day.